Welcome to 60 Sec Nursing. Today's topic is infection control. First, we'll learn the concepts. Then we'll solve NCLEX questions with clear rationales.
First, let's understand infection. Infection happens when harmful germs enter the body, multiply, and damage healthy tissues. This can make a person sick.
A hospital-acquired infection is an infection that develops after admission to a healthcare facility and was not present when the patient arrived. Now let's learn infection control. It means using safe nursing practices to stop germs from spreading and protect patients, nurses, and visitors.
Germs spread through something called the chain of infection. If we break even one link in this chain, the infection cannot spread. It has 6 links: agent, reservoir, exit, transmission, entry, and susceptible host.
Breaking any one link of the chain prevents germs from spreading and stops infection transmission. Standard precautions are used for every patient because any patient may carry infectious germs.
Standard precautions are 5 methods to prevent infection, and remember, use them for every patient every time. Number 1, hand hygiene. Wash your hands with soap and water or use hand sanitizer. Number 2, wear gloves. Wear gloves when touching blood or body fluids. Number 3, wear gowns and PPE. Use gowns and protective equipment if there is a chance of splashing. Number 4, respiratory hygiene. Cover coughs and sneezes to prevent the spread of infection. Number 5, safe injection practices and cleaning equipment. Follow safe injection techniques and properly clean medical equipment. These 5 steps keep both patients and nurses safe. Hand hygiene is the most important step to prevent infection before and after patient care. When it comes to hand hygiene, NCLEX wants you to know the difference. If your hands are visibly dirty with dirt or grease, always choose soap and water. Lather for 20 seconds, rinse and dry. But for routine patient care, use alcohol-based hand sanitizer. Just apply the gel, rub until your hands are dry. Remember this key rule: dirty hands need soap, clean hands need sanitizer.
There are 3 transmission-based precautions: contact precautions, droplet precautions, and airborne precautions. Contact precautions prevent infections spread by direct touch. Always wear gloves and a gown before entering the patient's room.
Contact diseases include C. diff, MRSA, VRE, RSV, and scabies. These infections spread through direct contact or contaminated surfaces.
Droplet precautions prevent germs spread by coughing or sneezing. Always wear a surgical mask before entering. In droplet precautions, wear a surgical mask within 3 feet of the patient. If you'll touch the patient, also wear a gown, gloves, and eye protection.
Droplet diseases include influenza, meningitis, pertussis, COVID-19, and pneumonia. These germs spread through large respiratory droplets from coughing or sneezing.
Airborne precautions are used for diseases spread by tiny airborne particles. Wear an N95 respirator, gloves, and eye protection. Place the patient in a negative pressure room. Airborne diseases include tuberculosis, measles, chickenpox, and COVID-19. These infections spread through tiny airborne particles that can remain in the air and be inhaled.
PPE stands for Personal Protective Equipment. It helps protect healthcare workers and patients by reducing the spread of germs.
Before entering an isolation area, put on PPE in the correct order: gown, mask or respirator, eye protection, and gloves. Remove PPE in the correct order: gloves, eye protection, gown, then mask or respirator. Always finish with hand hygiene.
A nurse is preparing to enter the room of a patient on droplet precautions and must put on personal protective equipment. What is the correct order for putting on PPE? Option A, face mask, gown, eye protection, gloves. Option B, gown, face mask, eye protection, gloves. Option C, eye protection, gloves, face mask, gown. Option D, gloves, gown, face mask, eye protection. After completing care for a patient on droplet precautions, a nurse prepares to remove personal protective equipment. What is the correct sequence for removing PPE? Option A, face mask, gown, eye protection, gloves. Option B, gown, face mask, eye protection, gloves. Option C, eye protection, gloves, face mask, gown. Option D, gloves, eye protection, gown, face mask. An infection control nurse notices purulent drainage, redness, and tenderness at surgical incision sites of several postoperative patients. Which action is the most effective way to reduce the incidence of surgical wound infection? Option A, assessing the wound site for pain. Option B, performing hand hygiene before and after each patient contact. Option C, encouraging adequate nutritional intake and early ambulation. Option D, supporting the incision and helping the patient avoid straining. A nurse is preparing to enter the room of a patient who requires airborne precautions. Which combination of personal protective equipment should the nurse put on before entering? Option A, gloves and a gown. Option B, gloves and goggles. Option C, gloves and a surgical mask. Option D, gloves, a gown, and an N95 respirator. An infection control nurse monitors how staff use precautions against influenza transmission, then leads teaching sessions to raise awareness among nurses and physicians in patient care areas. Which goal of nursing practice does this activity primarily reflect? A, infection control management. B, research and surveillance. EC, primary prevention. ED, health education. Which nursing action is appropriate when caring for a patient on contact precautions? A, serving meals on disposable plates with plastic utensils. B, instructing visitors to check in with the nurse before entering the room. C, rinsing the hands with water after removing gloves. D, placing a surgical mask on the patient during transport. Question 7. What term describes an infection a patient develops during a hospital stay that was not present or incubating at the time of admission? A, local infection. B, an endogenous infection. C, a nosocomial, hospital-acquired infection. D, a secondary infection. Question 8. Nursing staff on a surgical unit are required to report any illness a patient develops during hospitalization, particularly post-operative wound infections. What is the primary purpose of this reporting requirement? A, to limit unnecessary hospital admissions. B, to monitor and track the hospital's infection rate. C, to improve the general documentation system. D, to reduce nursing workload. Question 9. A 35-year-old patient is admitted with confirmed meningococcal meningitis. Which infection control precaution should the nurse implement? A, droplet precautions. B, contact precautions. C, airborne precautions. D, standard precautions only. Question 10. A patient is admitted with active pulmonary tuberculosis. The nurse places the patient in a private room with negative pressure airflow and ensures PPE is available outside the door. Which type of isolation precaution is being implemented? A, contact precautions. Mirribinda. Droplet precautions. C, airborne precautions. D, standard precautions only. Question 11. A patient with active pulmonary tuberculosis is cared for in an airborne infection isolation room. Which item is required when entering this room? A hair cover. B, sterile gloves. C, a fit-tested N95 respirator. D, protective goggles. Question 12. A patient with a forceful, uncontrolled cough and difficulty breathing is being transported from the medical surgical unit to the radiology department for imaging. The nurse applies standard precautions plus additional transmission-based precautions during the transfer. Who should wear a mask during transport? A. Radiology staff only. B. Both the nurse and the patient. C. The patient. D. The nurse only. Question 13. A nurse is teaching the parents of a child with bronchitis how to prevent spreading the infection to other family members. Which instruction should the nurse include? A. Perform frequent hand hygiene and teach the child to cover coughs and sneezes. B. Restrict the child's fluid intake until symptoms resolve. C. Keep the child on strict bed rest for the entire illness. D. Delay all routine childhood vaccinations until the child fully recovered. Question 14. The nurse receives report that a patient with streptococcal meningitis will be admitted to the medical unit shortly. Which type of isolation precaution should the nurse prepare to implement? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Standard precautions only. Question 15. Which nursing action is the most effective infection control measure for preventing hospital-acquired nosocomial infections? A. Performing hand hygiene before and after every patient contact. B. Wearing gloves and a mask for all direct patient care. C. Placing all patients on isolation precautions. D. Administering broad-spectrum antibiotics prophylactically. Question 16. To reduce the risk of transmitting infection from a patient diagnosed with diphtheria, which transmission-based precaution should the nurse implement in addition to standard precautions? Options: A. Airborne precautions. B. Contact precautions. C. Droplet precautions. D. Protective reverse isolation. Question 17. A patient arrives in the emergency department with an infection of unknown origin. Which action is most important for the nurse to take to reduce the risk of transmitting the causative organism to others? Options: A. Performing hand hygiene. B. Wearing gloves. C. Wearing a mask. D. Wearing a gown. Question 18. A nurse is teaching a patient recently diagnosed with bacterial conjunctivitis about preventing the spread of the infection to others. What should the nurse emphasize as the most effective preventive measure? Options: A. Putting on clean gloves before cleansing the eye. B. Taking prescribed medication as directed. C. Wearing a gauze eye patch. Performing hand hygiene frequently. Question 19. Which of the following practices are all considered part of medical asepsis? Options: A. Hand hygiene. B. Use of personal protective equipment such as gowns, gloves, and masks. C. Cleaning, disinfecting, and sterilizing equipment. D. All of the above.
Question 20. All of the following are risk factors for nosocomial infections except: options: A. Poor hand hygiene technique. B. Consistent use of sterile technique. C. Contamination of a closed drainage system. D. Improper technique during procedures such as dressing changes, suctioning, or catheterization. Question 21. During orientation for new food service employees, the nurse emphasizes performing hand hygiene after using the restroom. This practice is most important for preventing the spread of which infection? Options: A. Hepatitis A. B. Hepatitis A. C. Salmonella contamination. D. Cholera. Question 22. A patient has an infected wound colonized with methicillin-resistant Staphylococcus aureus, or MRSA. Which transmission-based precaution should the nurse implement to reduce the risk of spreading this organism? Options: A. Airborne precautions. B. Contact precautions. C. Droplet precautions. D. Protective or reverse isolation. Question 23. A nurse is setting up a sterile field before a procedure. Which action reflects correct aseptic technique? Options: A. Holding the lip of a sterile solution bottle 1 to 2 inches above the receptacle while pouring. B. Placing the sterile package on a surface below waist level. C. Reaching across the sterile field to position supplies. D. Considering the outer 1-inch border of the sterile field safe to touch.
Thanks for watching. Like, comment your next nursing topic, and follow for more NCLEX lessons. See you next time!